Welcome, everyone. My name is Christina McGuire. I am the internship coordinator with Santa Barbara City College. And today I am joined by Dr. Hunter and Linda from the Santa Barbara Ventura County dental offices. And they're going to give a little bit of a background on what they're looking for and just like entryway into dental assisting. So with that being said, I'm going to have you all take it away. And I have our PowerPoint up right now.
Thank you. I'll start. Hi, everyone. Thanks so much for coming. My name's Linda. I'm the executive director of the local chapter of the American Dental Association. And we have about 800 dentists in the Ventura and Santa Barbara counties. And obviously, we're looking to help our Santa Barbara County needs. Dental assisting is a great job. It's a professional job. It's set hours. It's working with a team. And unfortunately, there's no solid training program happening right now in Santa Barbara. There used to be, Santa Barbara City College used to have a dental assisting program, but they had to stop that years ago. So the nice thing about dental assisting is you can learn on the job, and dentists are ready to train you. We also have online training programs at the Dental Society. Our local dental society has been around for 100 years. We had our big celebration in 2019. So this is what we do, and we love preparing people for a wonderful career. I'm fortunate that I am joined by our 2023 president, Dr. Rich Hunter. He is a periodontist who practices in Camarillo, but he represents all the dentists and wants to let you know what it would be like to work in Santa Barbara. I did want to clarify, I know most people that come on and give a presentation have a specific office and maybe a specific chair that they're looking to fill, where we're representing all the dentists. And believe me, there's a need. There's probably an office around the corner from where you live that is looking for a dental assistant. So we aren't so much today speaking about a specific office, but about the career. And you can contact me at the Dental Society and I will hook you up. So with that, I will connect you with Dr. Hunter.
Thank you very much, Linda. Well, welcome everyone, and I'm definitely very excited to be here. As Linda said, I'm a periodontist in Camarillo, and I'll kind of in a little bit review on what I specifically do compared to the other different types of dentistry that's available, and kind of what the different roles are of a dental assistant in each of those types of specialties or variations of dentistry. But as Linda mentioned, we've seen a major shift in the dental career and the dental positions and assistants that are available. Pre-pandemic, we had a pretty good workflow of assistants in our community. There's always a small shortage, and so it's always been something that we've needed to fill and find more assistants. But since the pandemic, there has been a major shortage in dental assistants and even dental hygienists in our communities. And this is a very good opportunity right now to find a very good job, whether it's long-term or whether it's through college, or if it's something you want to experiment a little bit with to find out if dentistry and becoming a dentist is right for you, or if you want to stay as a dental assistant or even a hygienist. There's a lot of exposure in our offices. As you can see, dental assisting, it's very highly ranked, very sought after job. One of the best careers you can take, 25th best job in the world. But one of the best part is a lot of people compare it to nursing or nurse practitioners. And as Linda had mentioned, that the hours are usually significantly better. You're pretty much defined 8 to 5 jobs. Some offices might be 9 to 6, but you get to have a pretty normal life. There's no graveyard shifts, but you do get to help people. Something that a lot of people love about the healthcare is helping people in need, whether it's high-end dentistry and helping people recreate perfect smiles, or whether it's more on a public health service and being able to help people just get healthy again, working in different types of clinics. There's a large variety. Now, in my office, we've been fortunate to have a long-term staff, but it really does form like a family bond. And that's a great thing when you're working in small groups of anywhere from 5 to 12 people in a small office, is that you really get to know people. You really get to become part of a team. And as I mentioned, kind of a family. And that is a great thing about dentistry versus working in big hospitals, is that you do get to keep it very small, very intimate. You get to know your patients really well. And I'll be honest with you, my assistants work with my patients sometimes more than I get to. They get to talk with them. They build a trusting bond and a relationship that is extremely vital to the care of our patients and what they need. So it's very, very rewarding for yourself and for relationship building, but very rewarding when you get to see and help these patients. Now, as we kind of scroll down, we see the common duties, and some of them sound very routine. Taking x-rays would be a very new thing that you can be trained to. Even at the Dental Society, we do have a program to get your radiology license, so that way you can take x-rays. But most of what you're probably used to is seeing an assistant help the dentist chairside, handing them instruments, preparing materials, seating patients, sometimes taking medical histories. That way, when the dentist comes in, that they're very well informed with some of the medications that could complicate treatment. But there's a lot of different variety of tasks, and some of that kind of plays into some of the assistants working in both the front office and the back office. And the back office is more of the chairside assisting, whereas the front office is the person who's sometimes collecting payments, checking patients in, checking them out, booking appointments, and they all do fall under kind of the assisting category. Some are very directly associated with the back office, and working hands-on with the dentist, versus some being more in the front office working with patient care. Now, there are a few different types of dentists that we have, which we can see in the next slide. Public health, which, as I kind of mentioned, working with low-income communities, helping patients just get healthier who have struggled access to regular care. There's also oral pathologists, which we work closely with in my field, looking at diseases of the mouth, such as cancer. There's lots of things that aren't cancer, thank goodness, that we also biopsy and diagnose, and we send those to an oral pathologist. In addition to oral pathologists being lab technicians who are reading and processing slides, they also do treat these patients directly when it's something out of our scope. Another familiar one that most people know about are pediatric dentists, mainly children dentists. You see them from babies to adults. Sometimes they'll treat kids until they're 16 or sometimes even up to 18. But they're very vital for our communities. And if you have a passion working with kids, this is a great place to start, because you can really help these kids develop good habits and eliminate or prevent them from having a fear of the dentist. A lot of older patients develop fears early on from bad experiences to their parents had a bad experience and transfer that to them. So really working with kids, give them a great experience, and teaching them the right way to maintain their oral health is very vital for their upbringing. And then you'll see here cosmetic dentistry, which is a lot of what we do in general dentistry. You'll see a lot of patients with, wanting beautiful crowns and veneers and that Hollywood smile. And that's a lot of what cosmetic dentistry is focusing on, is getting that beautiful aesthetic outcome. Now, as we get a little further down, we're getting a little bit more into more specialization, and in some cases surgical. Orthodontics, most people know them because they do braces. There's a lot of things like Invisalign, that would be taking models, taking digital photographs for the dentist, and working with them to help putting braces on and off. This does take a very specialized type of training, even as an assistant, just beyond the normal assistant training, which is very fun and very rewarding to help these students help these patients get their teeth aligned. Next up, you see endodontics. Endodontics are the ones who do root canals. There's always a big stigma about root canals, but when it's a well-trained endodontist and their assistants and staff, endodontics and root canals are actually very, very comfortable and are very great for being able to save teeth. Once again, it can take sometimes a specialized training for this, but usually we start with general dentistry training and move our way through into a specialty. After that, you see prosthodontics. Prosthodontics is very similar to what you would get from cosmetic or family dentistry, but they're more highly trained with prosthetic devices, doing dentures, doing some surgical training as well, but doing very, very high-end aesthetic cases. Some of them really do focus on seniors or even cancer patients when they're reconstructing parts of the jaw that have been lost due to disease. Then you have my field, which is periodontics. We do a lot of surgery, and that's a big difference between us and the oral surgeons compared to the other fields. It's a lot of surgical and a lot of surgical assisting. These procedures are, obviously, in my opinion, fun. I love doing them. There's obviously a lot more blood and treatment and the bone and removing teeth, but as well as dental implants. But our main focus in periodontics is saving teeth, and that involves deep scaling, treating gum disease, and trying to improve the overall health of the mouth while really focusing on what we call the oral systemic health. That means looking at patients' blood pressures, diabetes, medications, and really focusing on getting their body healthier. And then last, we have oral maxillofacial radiology or surgery. And again, obviously lots of surgery, lots of removing teeth, wisdom teeth, a lot of dental implants, very surgery focused. A lot of the oral surgeons do a lot of sedations, meaning they put their patients to sleep. And it does require a special license for an assisting to become an oral surgery assistant, but again, very rewarding. And with some of these certifications, it can definitely be beneficial because with more certifications mean there's higher chance of increased income. So as you can tell, as Linda mentioned earlier, we have about 700 to 800 members in our dental society. Santa Barbara probably comprises, I'd probably guess, about a third of that population. So that gives an opportunity for about 250 to 300 dentists in Santa Barbara community that could really utilize dental assistants. Now, we do list the pay anywhere from $15 to $34 an hour, which is obviously an average depending upon how long you work there, what kind of certifications you choose to go after, and what kind of practice you work in will determine that kind of pay, but it's a very, very rewarding job. So from there, if anyone's interested, we'd love to see resumes, work histories, and we can help build some connections. But there's a lot of people hiring, and we are very, very excited to get to meet some of you and hopefully have a chance to work with you guys in the future. I'll let Linda focus on this one
Okay, great.
If anyone has any other questions.
That was great information, Dr. Hunter. Yeah, I don't want people to get too bogged down by thinking, oh, how do I put together a resume that highlights my qualifications towards this field if you don't have experience in that field. If you have a resume you can get to us, that's great. If you don't, I'll work with you. We'll figure out, and we can also talk together about if there's a specific kind of practice, as you described, that you're looking for, and what skills would be needed with that. So don't let the need for a resume scare you at this point, because we're just looking for people who are willing to learn, willing to be dedicated, and willing to help people smile again. So we started with some frequently asked questions, and then we'll open the floor to any questions you might have. Of course, the first question, understandably, would be what are the pay and benefits? And Dr. Hunter kind of covered that already. It can really vary. So we started, the base number is minimum wage, but up to 34 is probably 15 to 34 is probably a realm that we can look at.
And then to kind of comment on that a little bit is, in some offices, depending upon how many hours you work, in many offices you can work 1 or 2 or 3 days. In some offices you can work 4 or 5 days a week. And there are opportunities to get benefits such as 401ks and health insurance at times. It really just depends on, it's very office specific and owner specific. So that would just be questions, if it's important or necessary for you, just important questions to ask in advance.
Yeah, very good point. Since we're talking about 200 different offices, it's hard for us to say specifically what any particular office is offering at this time. So that is just part of the question. What are the hours you can expect? As we discussed, pretty good ones. Is working in a dental office safe? I brought that up particularly just because after, COVID and everything that we've gone through, that's a natural question. It's probably one of the safest places you can be. It's because the offices have always met all the infection control standards and then had to even up that exponentially during the COVID crisis. So yes, it's very safe, and there's been no known outbreaks of COVID, for example. Now we're worried about any kind of, don't even want to catch a cold, but since COVID was the thing that was studied, dental offices were never a source of that. What kind of training is required? So the nice thing about dental assisting is that it is a profession that allows on-the-job training as an introductory step. Then if you want to follow through with getting licensed, then we'll take you through that process. But that's not the door you're at right now. So happy to guide you along the way. And then other questions, have the Dental Society phone number. And again, we're the local chapter of the American Dental Association. That's our phone number. Please write it down, 648-7282, which is SBVC, Santa Barbara, Ventura County. It'll probably be Felipe who will answer the phone, and Felipe and I are here for you to answer any questions that you have as you go further in the process. But I would love to take advantage of the fact that we have he's our president of our society this year, President Rich Hunter, to answer any more specific questions.